So we're lucky enough to have Professor Maria Ribal, who is a urologist at Hospital Clínic de Barcelona and chair of the EAU guidelines panel. So who better to ask the question about what the guidelines currently say on this topic of the investigation of hematuria. And I'd really want to know, Maria, what you think about how the guidelines might be influenced by this work.
Thank you very much, Veeru. Good evening. It's my pleasure to be here. So thank you very much for inviting me. And well, what is in the guidelines? The truth is that in the guidelines, we don't have a proper flowchart on how to investigate hematuria. And probably you can think, well, how could this happen? And the truth is that it's really hard to find a clear consensus on how to evaluate hematuria. And we need to build proper models to do it. So what do we have in the guidelines? In the guidelines, we have, obviously, hematuria is the main symptom of, for example, bladder cancer or other cancers, and how do you should investigate. So, for example, in a bladder cancer, we have that for the workshop in hematuria, you need to do a flexible cystoscopy, or that, for example, you need to add a CT urography. Once you have diagnosed a bladder cancer, depending on where it's located, just to rule out the presence of upper urinary tract tumors. So the truth is that in our guidelines, what do we have is which is the strength of the recommendation for performing certain studies in a circumstance that you have an hematuria. But this has been an issue that we have been really worried about, and we have been working on that for a long time, trying to work together all the panels, the renal cancer panel, muscle invasive, non-muscle invasive, upper urinary tract. And the truth is that we should take into account that hematuria is not only a sign of cancer. So there would be other circumstances that could also lead to an hematuria. So that probably should be taken into account. But it's true that the main diagnosis that worry the most is cancer. So what are we doing in the guidelines? What do we need to create a proper flowchart to give recommendations on how to study hematuria? So we need probably three things. The first is to know the prevalence of the disease. And it's for that a study like Identify is really, really important, because it gives us data about the prevalence, and also give us data and something really important, that is to adjust this prevalence, taking into account several risk factors. So probably this is the main thing we need. So what are we doing at the guidelines? We are doing a systematic review. It's a joint venture with McMaster University. You know that the McMaster University in Canada is the birthplace of the evidence-based medicine, and also with Cochrane. And the review is already was registered on Prospero, and it will be published soon, and Identify as in. So we try to merge all the data to understand which is the final prevalence of bladder cancer, upper urinary tract cancer, renal cancer in the population with hematuria, and also to stratify, taking into account several risk factors, as you already have done, considering the age, gender, smoking status, etc. But the truth is that also this is the most important data we know, or we need. There's other data that we also need to be able to finally provide a flowchart on how to study hematuria. And which are the two things you need also? You need the accuracy of the tests. So it's important to know which is the accuracy of every single test to detect a specific disease in a specific circumstances. So what does it mean? For example, if I have a visible hematuria in a men over 50 and smoker, the most accurate test I can do is a flexible cystoscopy, because flexible cystoscopy is the one that has the higher accuracy for detecting bladder cancer. So you need to put all together the prevalence, the test accuracy, and finally, which is the other thing you need to take into account, is the expectations of the patients. Because, for example, it has been demonstrated on patients that only with 1% chance of having cancer, they are willing to be submitted to explorations. So we need to build all of this, and we are working on that.